If you wear glasses or contacts, you know the small but constant trade-offs we have to make. Rain fogs up your spectacles, long flights dry out your eyes. You always need to pack a spare pair just in case. And watching TV, playing sport, or reading road signs while driving without vision wear, you can forget it. So, relying on vision correction can be a bit of a daily grind, but it's not the end of the world, and it's not quite convenient either. So, what if you didn't have to? What if there were a way to regain natural, clear vision and say goodbye to glasses or your daily contact lens rituals? That's what we're exploring today. Two modern laser eye surgery options that can help you see clearly again, LASIK and SMILE Pro. To walk us through those, what they are and how they're different, I'm speaking again with Dr. Erica Darian-Smith, a Sydney ophthalmologist and co-founder of Eagle Eye Surgeons, where she and her team use advanced laser technology to help people gain freedom from their eyewear. But first, who am I? My name's Paul Salloway. I'm the owner of Optics Digital Marketing. We're an agency that helps independent eye care professionals to grow their practice. So, hello, Erica. Good to connect with you
Hi
again.
there, Paul. How you going?
Very good, thanks. Good to have a second video interview with you.
Yeah, excellent.
So for those who missed the last video, do you want to give us a quick overview of your laser eye surgery practice at Mossman and Nepean in Western Sydney?
Yeah, sure. So basically, our practice is called Eagle Eye Surgeons. We're a state-of-the-art facility that we're a general ophthalmology practice, but we also subspecialize in refractive laser surgery. So we do a bit of everything. But specifically today, we're talking about our refractive surgery component. So we have a ZEISS laser suite on site with the latest ZEISS lasers, so the Visumax 800 and the MEL 90, and also the latest diagnostic technology. We touched on that in our last interview. But basically, that technology is able to give the latest diagnostic and the latest laser results. And we also have an optometrist on site as well at our clinic. So we use all of these facilities together to basically offer, as you said, LASIK and SMILE Pro to our patients. And that's, yeah, and we have a couple of surgeons that are doing refractive laser surgery. So myself, Dr. Mitchell Lee and Dr. Linda Zeng, and we all work together to kind of try and get our patients out of glasses and contact lenses.
Excellent. All right. Well, I think probably a lot of people have heard of LASIK because it's
Yeah.
been around for a while now. But I think Smile Pro is kind of a new one on the scene. But
Mm-hmm.
can you tell me, like, in terms of how you perform each of those procedures, how are they different?
Yeah. So LASIK has been around for longer than SMILE. SMILE's still been around for quite some time, but LASIK definitely has been around for longer. LASIK we'll start with because it's been around for longer. It's a flat-based procedure. So with LASIK, I use two lasers. I use both the Visumax 800 and the MEL 90. So the Visumax 800 is a femtosecond laser. So when people talk about LASIK, there's the very old LASIK that not that many people do anymore, which is called the microkeratome or the blade LASIK. And that's really not really done anymore in most places because we have much better technology now. So we have the femtosecond laser, which is the bladeless laser, and that creates the flap, which is the first part of the LASIK procedure. Then the surgeon, so myself, surgically lifts that flap. And then I use the excimer laser, which is the MEL 90, to give that refractive treatment. So the refractive treatment is essentially your prescription in your glasses or your contacts. We obviously have to tweak that a little bit, but it's that script that you're wearing that we can put inside your eye. Then the flap goes back down, and that is the procedure for LASIK. Smile Pro is the latest version of Smile. Smile Pro has been also around for a few years. It's not completely brand new by any means, but it's a newer version of Smile. And this is different to LASIK. So with LASIK, we create a whole flap in the cornea or the front part of the eye. With Smile, only a very small incision is made. So my incision's around 2 millimeters. So that's similar to the incision that's made in cataract surgery. So it's a very small incision that's made in the cornea again. And it only uses one laser. So with us, we use the ZEISS Visumax 800. So that's the only laser that can technically deliver Smile Pro. So there's older versions of the ZEISS lasers, so the Visumax 500, which is your traditional SMILE. And then the Visumax 800 is where we call it the Pro or the SMILE Pro. That's just because it's the latest version. And it has advantages that the older lasers don't have. So with SMILE, a small incision is made, and then the laser actually creates a disc inside the cornea. And the disc is generated again based on the type of, like the degree of refraction that you have. SMILE Pro can now be done for both long-sighted and short-sighted patients. So traditionally it was just short-sighted patients, and usually in the range of around a -2 script to around a -8 to 9 script. That was kind of the range, with up to 5 diopters of astigmatism, so that, you know, when the cornea is not shaped like a ball, it's shaped more like a rugby ball. That's when you get astigmatism in your eye, so we can correct for that with the laser. So SMILE Pro can do both long and short-sighted scripts. The long-sighted version is much, much newer as of this year, whereas the myopia or the short-sighted version has been around for quite some time. And the reason why it's Pro is because it's not just for a cool name, but it's because the speed and the accuracy of the laser is just a lot better than the old version. So the time to create that little incision and that disc, that refractive disc that then I surgically remove from the eye, is minimized greatly. So depends again on the size of your prescription, but the surgery can be, you know, very, very quick. Like we're talking under 30 seconds in some cases. And that's important because it means that the patient, there's less time that the laser is actually on the patient's eye. So the suction cap for the laser is on the patient's eye. So complications like what we call suction loss, so that's when the laser disconnects from your eye, or just the time for treatment, anxiety levels for the patient, all of these things are dramatically reduced when the time of treatment is dramatically reduced. So you really don't see as many complications anymore. It's a very safe and effective procedure. And then the surgeon, so that will be me, will remove that disc from the cornea, and then you're left only with a very small incision. So it's slightly different to LASIK because you don't have that big flap, but they both have very similar end outcomes in terms of the vision that you're getting.
So I'll admit it took me a little while for me to get my head around this, but
Yeah.
as I understand it, correct me if I'm
Yeah.
wrong, but with LASIK, it's kind of like you're opening the surface and then using another laser
That's right.
to reshape, what you need to
Cornea.
reshape in the
Yeah.
cornea. Whereas with SMILE, it's like you're making the incision sort of without actually making the incision, and then removing it through a
Yeah,
through a
so I
smaller
think,
incision. Is that right?
yeah, so with LASIK, you're basically creating a little flap which you lift like a trapdoor.
Yeah.
Then the treatment that you do, so if it's a treatment for, say, if you're short-sighted or myopic, the treatment will flatten the surface centrally. And if you're long-sighted or hyperopic, the treatment will flatten the surface peripherally, so you'll get steeper in the center. So it just does different things depending on your script. And then the little trapdoor goes back down. In SMILE, the laser makes that tiny little cut in the cornea, and then it actually, the single laser, so just the Visumax 800, creates that disc that I was talking about. Then we remove that disc,
Yeah.
and then that area just settles down and you're just left with that small cut. So it's quite different technically, and it's different for the surgeon. It's a very different procedure, but with actually the same end outcomes. Now, ZEISS celebrated earlier in the year, they've done 10 million SMILE cases worldwide. So even though we're talking about a newer procedure, it's not by any means it's not new. It's been heavily used, so it's extremely safe. Like you've got 10 million eyes of data there. So it's just as reliable and safe as LASIK. And there's pros and cons to both, which I'm sure we'll touch on later on in the discussion.
Yeah. Yeah. So SMILE, of course, stands for small incision lens extraction, doesn't it? So it's
Lenticule, not lens, because it's
sorry,
a lenticule.
my
So
mistake. Yes.
the L is lenticule because what lenticule is just a fancy name for that disc that I keep talking about. So yeah, so that's what SMILE stands for. And then there's other types of procedures that have they're similar to SMILE. So that SMILE is trademarked for ZEISS, so you can only use SMILE or SMILE Pro, which is what we have, if you have ZEISS lasers. So that's trademarked to that company. Then different companies have similar procedures. So again, they're lenticule or disc based. They have slightly different technologies and slightly different ways that it's done, but it's all called kind of lenticule extraction surgery. So SMILE specific for ZEISS, and then you've got Silk, and you've got a few others. So it gets very confusing for patients because there's lots of different terminology. But really, all you need to know is that lots of different lasers are on the market. They all have different pros and cons. There's lots of different companies. But SMILE with ZEISS compared to other companies, my understanding is it's had by far the most procedures done globally for lenticular extraction surgery. So as I said, 10 million, whereas some of the other companies haven't reached that because SMILE has actually been around. ZEISS was the first company that came up with that lenticular extraction surgery. But, you know, like everything, there's lots of different options for patients, and we're always happy to chat to patients about. I have lots of patients come and ask me questions about all the different names and all the different procedures and all the different lasers. And I think it's important for surgeons like myself to be up to date with all the different companies and what's on the market because there's a lot of crossover. And at the end of the day, a lot of the outcomes are very similar in terms of whether it's flat based or lenticular based.
Okay, so I think we've got some understanding now of LASIK and
Yeah,
SMILE or SMILE
yeah.
Pro. So, like as a patient, which one is better for me? And I guess it comes down to a couple of things, doesn't it? One is like lifestyle, and how that influences what's best for what's my best choice, and the other could be like actual medical criteria, things that you check in terms of like the condition of my eye.
Yeah.
So let's talk about lifestyle first of all. So
Mhm.
like how would lifestyle play a role in you figuring out which is the best option for a patient?
So I think the most important thing I work out in my mind when I'm working up a patient for laser is I like to get a really good idea about their lifestyle and what they do for their occupation. So what's their job and what are their hobbies and why do they want to get out of glasses? So they're like my first questions usually for a patient, like why are they here and what's the like why they started this journey with us. And that gives you so much information. So for Smile Pro, I've had a lot of athletes, a lot of people like that do contact sports, mixed martial arts, things like that. Because of that small cut in the cornea, that small incision, there's not that whole area, that whole flap that can potentially be disturbed if you were to have trauma to the eye. Now, we're talking about very, very rare events. So the majority of people that have LASIK never have any problems. They have it till the day they die. Those flaps aren't touched and everything's fine. But there is a very small risk that if you're doing combat sports or mixed martial arts or things like that, and someone was to get a fingernail in the wrong place at the wrong time and it just nicked the edge of that flap and it lifted the flap, there is a very small chance of what we call flap dislocation or flap trauma. And it's just minimized completely, or basically it's completely avoided with Smile Pro because the little cut we make is under your eyelid. So the chances of that 2 millimeter incision being open is basically negligible, just doesn't happen. So if I have really keen athletes, or I've done quite a few mixed martial arts players, I've done a few rugby players now. So those kind of people, I usually lean towards Smile Pro. It also comes down to, as you said, when you assess the eye, many factors. So it's not just lifestyle, but that's one of the factors. But then you look at things like their prescription. So up until recently, you couldn't do hyperopic or long-sighted smile. So that was off the cards. So for anyone who was long-sighted, LASIK was a better option, or was the only option in terms of laser surgery. And also with Smile Pro, the prescription really does matter. So very, very small prescriptions. So say you're a -1, the little disc that I keep mentioning, that becomes too thin with really small scripts. And surgically, that becomes too challenging to remove. It's not really safe to remove. So for very low myopic or short-sighted scripts, we usually opt for LASIK as well. So it varies depending on the patient. We can do some things artificially with a laser to bump up the size of that disc, but on average, if you're around a minus 1.5 or lower, usually LASIK is a LASIK or PRK, which we haven't really chatted about today, but they're better options than your SMILE Pro. And then we can also look at the health of the eye, so how dry the eye is. So for patients that have pre-existing dry eye, SMILE Pro is generally also my recommended option. And that's, again, all comes down to that little cut in the cornea or that little incision. So with LASIK, when we create that flap, we are cutting through a lot more corneal nerves. So in the surface of the cornea, there's little nerves that, innervate the surface, and they help with keeping the eye lubricated and the tear film nice and healthy. And with LASIK, because we're making that kind of can opener shape, we are cutting through more of those nerves. Whereas with SMILE, it's only a 2 millimeter incision, so there's only very slight disruption. So we do find that dry eye is usually worse in the short term for LASIK. There's been large meta-analysis studies that have shown that 1 year the outcomes are very similar for the two. So we're talking more about in the immediate phase. But generally, I assess the dry eye, and if they do have more dry eye, I push them more towards SMILE Pro because it's just going to be a nicer and quicker recovery, more stable refractions, and more comfortable for the patient. They might not need to be on so many eye drops post-operatively. So these are just many of the factors that go into our decision making for whether we determine whether a LASIK or a SMILE Pro is a good option for the patient. And it's really nice to have multiple options. So we also have PRK. So we have 3 different options really for laser that we can offer patients. And it's actually, I use all 3 of them because every patient is individual. And you notice that every patient, you have to tailor the treatment for every specific patient. So there's no one rule fits everyone. And that's really nice that we have those options, and SMILE Pro just adds to those options basically.
So you said that with Smile Pro now, you can also do something to help people who are hyperopic, meaning they
Hmm.
are long-sighted. They struggle with up close, but they can see fine at a distance. And so that's kind of like a big advantage of Smile Pro for those people, would you say?
Yeah, look, I think it's much newer. So the hyperopic or the long-sighted SMILE Pro is actually quite new. So I don't, unlike the myopics or the short-sighted SMILE Pro that we've been talking about, where there's been 10 million cases, we don't have the same long-term data, but the initial results are really promising. And we already know we can get really good results for hyperopic or long-sighted patients with SMILE, with LASIK, sorry. So I do quite a lot of patients who are long-sighted with LASIK,
Okay.
but there's only a certain range of prescription again that's suitable for laser. So that this is getting quite technical now. But when you come for your assessment, when the patient comes, we go through all of this with the patient and we work out if we think their script will work with SMILE Pro or if it work for LASIK, or whether we actually need to do a completely different option like inside the eye, so a lens-based option. So again, this is why our assessment takes quite a long time. So the initial laser assessment, it's an hour and a half. It's quite long. Patients are always quite shocked at how long it is, but it's really because as you can see, there's quite a lot of factors that go into the thought process behind it. It's not a 2-minute rush decision. It's actually quite complex. The hardest part of laser is actually the workup and like the suitability and working out what's the best procedure for the patient. So yeah, I think there's lots of options now, but it has to be very individualized.
And before we move on, so I think we should maybe just mention again that people who suffer from presbyopia, which is
Yeah,
that condition
yeah.
you get from too many anniversaries of your 40th birthday. So that is something that LASIK and Smile Pro doesn't or isn't intended to address. Is that right?
No, so as we chatted about last time, Beyond is a type of LASIK procedure.
Okay.
So we're still doing LASIK, but it's a special type of LASIK procedure that combats not only presbyopia or that loss of near vision that you get from 40 and up, basically, but it also can fix any scripts. So it's a double whammy. So you can fix your short-sightedness or your long-sightedness, but we can also fix the fact that you need glasses now for reading. but it's still a LASIK procedure. At this stage, we don't have Presbeyond in the SMILE Pro platform yet. I believe that that might be coming in a few years, but it's not here yet. So it's still a LASIK procedure, but it's a specific, again, a specific ZEISS platform that we use. But it's actually a lot of what I'm saying today is very relevant for even those presbyopic patients who are undergoing LASIK for specifically presbyopia.
All right. Well, so you mentioned that, there is like a lot of pre-work that you do before anyone gets to the surgery stage. So maybe like could you tell us like what should patients do to prepare in the days and weeks even leading up to, I guess, first of all, before their assessment and before the actual day of surgery itself. So
Mhm.
are there any things that they should do or shouldn't do
Yeah.
prior to those two events?
So we'll break it down. We'll start with the initial assessment. So before the initial assessment, patients can basically read. We've got a really nice booklet that we've made for the clinic, and I've also got a little video that I've made for my patients. So you get sent those things before the initial appointment. So it's really good to read those because it gives you a really good overview what the procedure is, what the risks are, a little bit of information about the day of surgery, and a lot of the stuff that I'm talking about today is actually in that booklet. So that's the first thing. So then you're already coming to the appointment with lots of questions. So then I can answer them on the spot or during the consult. It will just mean more to the patient. So that's the first thing. Second thing is if they're a contact lens wearer, they need to take their contacts out for a minimum. We say 48 hours for soft contacts and a minimum of 5 days for hard, but it actually varies a little bit depending on the frequency. So how often you wear the contacts and also the type. So with hard contacts, like Ortho K, it can actually take weeks to months for some hard contacts or Ortho K contacts to wash out, but we go through that in more detail at the consult. So I don't want to confuse people too much, but basically, if you're a contact lens wearer, we will give you advice around that. You also need to be aware that you'll be dilated at the appointment. So that means that your pupils will become big and blurry for a few hours, and that's so we can get a look at the health of your eye in total. So we can look at the retina and the optic nerve and make sure you're a safe candidate for laser overall, because
You
generally we
do
only do laser.
you do that with eye drops, right?
Yeah, we just put some eye drops in, and then they usually last for about 1 to 2 hours. So it's just not safe to drive straight away. So lots of people bring a friend or a chaperone, or they just stick around and have tea and Tim Tams and things at our practice until the drops wear off. But it's just important to be aware of a contact lens wear, dilating drops, pre-information in the form of both a booklet and a video that I've recorded. And then they come to our appointment, they have all the scans and everything's done there. Any information from their optometrist is really useful. So lots of patients come with letters or referrals from their optometrist, but also some patients are really amazing and they'll come with a list of all their previous prescriptions for their glasses over the last 5 or 10 years. And it's so helpful because then we can check for stability of the script. So generally, as a general rule of thumb, we need the prescription to be stable for a minimum of a year. The longer, the better. If you come in and you show me that it's been stable for 5 years, I'm delighted. But as long as it's been relatively stable for over a year, we're happy with that generally. And then you'll have your assessment with the optometrist or one of our ophthalmic technicians first. So that's usually our free assessment. And then if you look like you're a candidate based on that, then you're booked into with a consult with me or one of the other two refractive surgeons. And then we go from there. And that's when we work out kind of which is the best procedure for you. Then when you get to surgery day, so say you've had your assessment with one of the surgeons, we've worked out that you're good for SMILE Pro. Then you'll again receive more information about day of surgery and you'll book in a date for the surgery. So usually we can get you in within a few weeks after the assessment. And it's usually on a Friday. It varies, but it's mainly on a Friday. So if you do a surgery on a Friday, most people are back to work Monday or Tuesday the following week. So that's kind of nice because you have the weekend to recover. And then we go through in detail what to expect day of surgery in some written information, but also on the day of surgery. And essentially, briefly, it's basically your eyes are numbed with some freezing drops. And then the surgery itself is relatively painless. It's pretty quick. It's less than 10 minutes per eye. And then you go to our recovery area and then you're going home within 1 hour, 1 to 2 hours of when you arrive to the practice. So it's all pretty quick. That night, it's usually slightly uncomfortable, like sands in your eye, or like there's a foreign body sensation. But we give you drops to combat that, and it's really not, I don't hear many patients complain about it at all. Most people say it was a little bit uncomfortable, but then they come in the next day and it looks like they haven't had surgery, and they're usually very comfortable by the next day.
So you said that it's typically like a couple of weeks between the initial assessment and the day of surgery.
Yeah.
So, like typically, do you tell patients not to wear contact lenses during that period of time, or is it okay
Yeah,
for them
most
to
of the time.
wear
I
it?
mean, again, the rule is for soft contacts, they need to be out at least 5 days before the surgery. So ideally, they just stay out of them, but it needs to be a minimum of usually 5 days before. Hard contacts are a different story because it depends on the type, it depends on the frequency, it depends on how many years they've been in them. It can literally take a month per decade of use for them
Mm.
to totally wash out. So we don't see that as many hard contact lens wearers anyway. Most people are using soft dailies or fortnightlies or monthlies, and they're disposable. So it's not usually as much of an issue. But if you are a hard contact lens wearer, or you've been in ortho Ks or anything like that, it is good to have a chat to us. You can just give us a call and we'll give you some specific advice for your situation, because it's hard to kind of make a general rule of thumb about that.
Do you ever have patients who are getting out of sclerals because sclerals actually like they vault over the cornea, don't they? They should
Yeah,
have
so
no
sclerals are
impact on that.
easier though, because
Yeah.
sclerals, because they vault over, the washout's really quick. So we see that with like keratoconic patients, so patients that have abnormalities of the cornea and they wear scleral lenses. When you're monitoring them with corneal tomography or pentacam scans, if they keep their sclerals out for a day or two before the appointment, you usually find it's quite accurate. So because of the vault with sclerals, it's actually different again. This is why I'm saying hard contacts are a little bit of a different story compared to soft. So just best to get individualized, your individual story, and then we can work out when to take them out safely before surgery.
All right. So we've talked about the lead up to the surgery and the
Yeah.
day of surgery. Let's talk about what happens after the surgery. So you said that in a lot of cases people will experience maybe a little bit of discomfort, like not maybe even discomfort, but they will feel like a sensation that they've maybe got a foreign object in the eye,
Yeah.
and maybe a little bit of dry eye as well. So how is that sort of recovery period different for somebody who has traditional LASIK versus somebody who has Smile Pro?
So I think that the overall sensation of irritation and the foreign body sensation, or that discomfort on the initial night, I think that goes for both procedures by the next day. I think that with LASIK, anecdotally, most of my patients just need to use a lot more lubricants and drops for a longer period of time than my Smile Pro patients. I think with both categories, LASIK and SMILE Pro, because we're disrupting the tear film, at the end of the day, we're having surgery, we're using drops. So we're pretty careful because I'm a corneal specialist. At our clinic, I make everyone get customized preservative-free post-operative drops. So everyone's on preservative-free antibiotics and steroids after their surgery, and we get those custom made through a really great pharmacy that works with our clinic. So I think that already reduces some of that burden because you're using preservative-free drops, and then also my patients use regular preservative-free lubricants after the surgery. So we do what we can to minimize it, but I do think that with LASIK, you will feel those dry eye symptoms. Some people will feel those dry eye symptoms for a bit longer than SMILE. I'm talking months. I'm not talking extended. Usually by the 3 month mark, you return to your baseline, so what you were previously. So it's usually a short period of time. And as I said, there's been a large meta-analysis, so a large study that's looked at SMILE and LASIK after a year, and the dry eye symptoms are very similar. So I don't think that this is a major factor for most people because we very carefully screen patients. So if patients have severe dry eye, they usually don't have laser, they're not candidates. Or you have to pre-treat them with IPL, so intense pulse light therapy, or you have to pre-treat them with a cyclosporin drop. So or you have to use those things again post-operatively if they're a slightly higher risk candidate. So we're very careful with our dry eye assessment, and we have to see how motivated patients are. So if someone does have some dry eye, but that we know that they're going to use their drops well and they're going to tolerate other treatments in addition to the laser and they're prepared mentally to do that, then they're not ruled out from having laser surgery. And I've had very successful people who I've treated their dry eye and they've had laser surgery and they've had a great outcome from their laser. But I think for the standard person, if they do have very bad dry eye, it's generally contraindication to laser, but it's not always. I think it's just important. And again, that's because I'm a dry eye specialist and a corneal specialist. I can make that call. But as a general rule of thumb, it's one of the things we look at very carefully before people have laser. And then that might change what we do. They might end up having implantable Collamer lenses, so ICLs instead of LASIK or SMILE. If they've got really dry, we don't think that they're going to have a good outcome. One of the ways that you can also assess is how stable their refraction is. So usually people with very dry eyes do not have stable refractions. Like their scripts are not stable. They're usually all over the place. Their vision fluctuates. It's all a bit of a mess because their tear film is unhappy. And that's another way that we can determine suitability.
So you said that usually you do the laser surgery operations on a Friday and people are ready to go back to work on Monday. Do the eyes look red? You know, like should people wear sunglasses for the first few days afterwards to hide their eyes? I mean, does it just look natural?
It's actually pretty unbelievable. So LASIK and SMILE are the same in the sense that so that day patients come out of surgery, you're tearing, you feel like crying. We provide you with a little pack which has sunglasses in it. So we have all that sorted for you because they're prescription-free sunglasses because you won't need a script. That's the whole point. So that day when you have the surgery, you'll definitely feel light sensitive. You'll feel very teary. You'll feel a bit uncomfortable. And then you just go home and you sleep. And then when you wake up the next day, it's literally like you've never had surgery. Your eyes are white. So again, the type of laser we have, it's not a scleral suction laser. So some of the other ones are. So we really very rarely get red eyes. So like that's basically called a subconjunctival hemorrhage. That's when one of the little blood vessels on the surface of the eye is disrupted. So we really don't get those with the ZEISS lasers just because it applanates the little head that sits where the laser is actually just sits directly on the cornea, and the cornea is avascular. So we really don't get that with our lasers at all. I can't remember the last time I had one. So that's good. So the eyes are white. So that's nice for the patients. And also it just doesn't look like you've had surgery at all from literally the next morning.
All right. Well, and okay, so what about in the weeks or the months after that? Do they have to come back to you for like follow-up checks? Should they, also be seeing their local optometrist during that time? What does it look like? What does that process look like?
Yeah, so they have the surgery. We always see them the next day, and that's just to check the position of the flap or just to check that everything's looking good after the surgery. Sometimes with SMILE, the option is to see us a few days later. That's fine. But LASIK, I always see the patient the next day just to check their flap. So there's usually around a day one assessment. There will be an assessment around 1 week, 1 month, 3 months, and 6 months. Anytime during that period, they're also welcome to see their own optometrist. We can do collaborative care we do that with some of our local optometrists. We also do that with some of the patients that are traveling from far. So I have patients that come from Queensland. I have patients that come from the Central Coast, just from all over New South Wales, Canberra, especially for things like Presbeyond, because lots of places aren't doing Presbeyond. So for those patients, we definitely work in, collaboration with the local optometrist from where they're from to do some of these assessments. But patients are always welcome to come to these assessments. They're kind of like our compulsory assessments. And then depending on geographic location, we can kind of be a bit flexible. But that's the setup. And then we see them at 1 year. And then generally at the 1 year mark, we discharge them back to the care of their optometrist for annual health checks. So anyone who's had lasers should still be assessed annually forever. Because it's just good to check on the health of the laser, but also the health of the eyes. Lots of these patients, you've got to remember, have very high scripts. That's the whole reason that they want to get out of their glasses, so they're very short-sighted, and short-sighted patients have a whole host of issues that they can get separate to laser. They can get glaucoma, retinal tears, retinal detachments. So it's very important that these patients don't forget that even though we've corrected their script, they've still got myopic or short-sighted eyes. So they still need to see their optometrists annually, and they still need to make sure that, they're keeping really good overall eye health.
I see. Okay. Well, this has all been very informative. So thanks for sharing that. And before we wrap up, is there anything else that you wanted to add, Erica?
No, I think that we've covered everything pretty well. It's usually a really exciting time for most patients. They've
Yeah,
been waiting a long time to get this done, lots of patients, and it's a really big deal. And it's really exciting as a surgeon to see the next day results and the, ongoing results. But really, the next day results are pretty exciting because they come in and they're, nearly always better than 20/20 the next day. And it's just the sheer joy is quite palpable. So it's a really exciting procedure. And it's overall, we didn't really touch on kind of risks and things today, but overall it's pretty safe. Obviously, everything has risks, but overall that there's a very high success rate. But you can read a little bit more about that in our booklets and on our website. We have heaps of information on all that stuff. So we don't want to get too technical today. But overall, it's a very safe and exciting procedure, and it's a real life changer. We've had lots of patients anecdotally. Again, our Google reviews, lots of patients are really kind, and they say say how life-changing this procedure is.
yeah. Well, I think if you've been living with glasses or contact lenses for many years, it must be like a game changer for your whole
Yeah,
lifestyle.
exactly.
Okay, so just remind us, how can people get in contact with you and your practice?
Yeah, so basically you can give us a call or you can go on our website. We also have Instagram and Facebook and LinkedIn and YouTube, I believe. So you can go on any of those platforms and there's usually a bookings button. Remember that the initial assessment for our laser patients is free. So it is good just to come in and to see if you're even a candidate first before you get too caught up in the whole thing. And there's always other options as well if laser is not an option. So as I touched on before, there's lenses that we can put inside the eye, which are called ICLs. For older patients who are looking at presbyond, we can also look at lens extraction or cataract surgery or lens base surgery. So there's always lots of options. So it's good just to come with an open mind because you might have your heart set on Smile Pro, but you might end up getting something else. And we can usually find a good fit for most of our patients.
All right. Well, if you found this video helpful, then as Erica said, there is a YouTube channel. You're probably watching it right now. So give us a tap on the like button because it really helps us out with the algorithm, and it allows other people to benefit from this information as well. And if you'd like to stay in the loop with Eagle Eye Surgeons, then subscribe to the channel by all means. Yeah, and also don't forget follow Eagle Eye Surgeons on their Facebook business page or Instagram accounts for the latest news, promotions, and events for both clinics. All right, well, I think let's wrap up there today. So thanks a lot, Erica.
Thanks, Paul. Chat
Okay,
soon.
goodbye, everyone. Have a terrific day. Bye-bye.